All right, let's rock and roll, people. I'm so excited to do this. What's up, everybody? I'm so excited to be able to do this show tonight with Alex Barrios Jr. and my co-host, the fabulous Lisa Baxter. Where am I exactly? Anyway, it'll be starting soon. Stay tuned and hold on for a great show. Hey, what is up, everybody?
Good evening. Hello.
Hello, Alex. Hi, Lisa. Thanks for coming on and joining me on tonight's show. And you know what, Alex? I've been looking forward to this broadcast for a long time. I have the opportunity to do this live broadcast, and I choose not to give it a name or a brand because I want to give focus to the warrior as much as possible. So, in essence, it is the Alex Barrios show tonight.
Right on.
That's what I'm talking about.
Oh, y'all are too kind. Too kind.
All right, it's your hour.
Sure.
So how are things going in Kentucky?
Things are going A-okay in Kentucky right now. Some beautiful weather actually is about to come through. So spring is kind of slowly creeping its way into this part of the country. It's much needed. So I'm glad to, looking forward to the nice weather to get outdoors with my family, be able to take walks in the park, walk my dogs, and I'm looking forward to it.
Right.
I love good weather.
Yeah,
all right. Well, I appreciate everyone joining the show. And speaking of which, Lisa, you're in the NYC. How's the weather? How's everything there?
Well, I tell you one thing. I just got in from work not too long ago, and it was cold out.
Lisa,
it was cold when I left. It was cold when I got back. But Sunday's supposed to be almost 70, but it was cold today, and it was cold yesterday. So that's how it's been so far. And thank you for having me on. I know we're gonna have a blast on tonight. We got to get that kidney.
All right. Well, I so much appreciate you joining us tonight, Lisa. It's so nice of you to come on.
Hey, let's do it.
I think we have Chris Ann Hernandez join us here. So when it's going live in our kidney donor awareness group, you have to click on something in order for your name to show up. So sometimes the name doesn't show up. Oh my goodness! So Chris Ann Hernandez just had surgery a few days ago. She had to have a kidney removed due to a lesion being found on her kidney. So thank you so much for joining us, Chris. And I can't say enough about how happy I am in terms of your surgery going well. That the lesion and everything on your kidney didn't seem at all so far to the doctors cancerous. The pathology results should be coming back soon. All right, so we also have Karen Dialysis joining us. Thank you, Karen, for joining us.
Thank you.
We got everybody coming in. Wow, the support is just flooding in, inundating for you, Alex. How do you like that, man?
Oh, it's very humbling, very humbling. Thank you so much for all the support. And just
right, and Philip Harris Jones Jr. Even we got Philip Harris Jones Jr. from A Second Chance.
Nice. What's up, Philip? How are you, buddy? Welcome. Thank you.
All right,
So where shall I
so you
begin?
have
Where shall I begin, Jeff? What would you like me to start?
right now. So this isn't your first rodeo with
In dialysis,
end
right?
stage kidney disease, right?
That's
And
correct.
dialysis. You're right now on peritoneal dialysis, but you had to start on hemodialysis first when you came back to
Yes.
dialysis. And how long have you been on PD, and how long were you on hemodialysis the second time around here?
Sure. Yeah. So I started hemodialysis in July of 2020, and was on it for about 6 to 8 weeks, and then have been on PD since like September of 20, give or take, and have been on it ever since September 20 till now, and currently still on it.
Hmm.
Yep.
Right. And I know that PD gives you a little more freedom in terms of your work,
Yes.
uh,
Yes.
spending time with your family, and that's ultra important. You have a daughter, you have
Son, I have a daughter
Abigail,
and a
and you have
son.
a son,
Yeah.
Xander, and you're married. You have a wonderful family. So yeah, PD gives you that freedom, and the luxury affords you time to spend with your family.
Correct. Yes, most definitely. That's definitely a plus about peritoneal dialysis. There's some negatives to it though. I don't know if we're going to jump into that yet, but there's definitely not some. There's some negatives to peritoneal dialysis as well.
That's what I
Right.
was going to say as well. That's what I was going to ask you about, but I'll wait like you waiting
Yeah.
in the cut. I'll wait in the cut until I can get to that point in that time because
Sure.
I had two siblings deal with the PD also,
Yeah.
so I know things about it.
Sure. No problem. We can. I'll
Right.
gladly when we're ready. Yeah.
Absolutely. Okay, so now the first time, when did you first find out that you had kidney disease? And this was when your early 20s, right?
Correct. Yeah, I was 26 years old actually, a little in my mid 20s. I had thought I
Uh-huh.
had food poisoning, and so I was not feeling well. I was just I was nauseous, having vomiting spells, fever. Just was really stressed, like I was just not sleeping well. Had a lot of numbness, and so I went to an immediate care clinic in my home here in Kentucky. And they were giving away free blood pressure screenings. And there was at this point, I had just moved to Kentucky, and I didn't have any health insurance. So I went and was like, well, this is a free blood pressure screening. At least I can get that checked
Hmm.
out, see what's going on. Well, my blood pressure was like astronomically high. It was like 210 over like one something. And the doctor or the nurse
Oh, wow.
practitioner was very like, hey, we need to get you, in a hospital bed or at least in a place where you can lay down, because they were afraid I was going to have a stroke. Um, I luckily did not have the stroke.
Oh,
Was luckily enough. The day I
right.
actually went for this screening, I felt fine. The day I went, I didn't have any headache. But 2 days prior, I had like one of the worst migraines. I mean, I was having nosebleeds, all the signs and symptoms that I now know what to look for when you have high blood pressure. I didn't know it as a kid,
Right.
in mid 20s. I was, so I kind of crashed into it. Again, thought I had food poisoning. Went in, got my blood pressure checked, and then was in the hospital for 2 days, I think, with uninsured, completely no insurance. And was like, they ran a boatload of tests, did ultrasounds, did all kinds of blood work, you name it, all the labs under the sun. And when they went to go do an ultrasound, they only found one
Uh-huh.
kidney. I didn't know I was born with one kidney. I thought I had two
So,
kidneys like we all did, So at my mid 20s,
right.
I thought I had one.
So you didn't actually find out that you were born with one kidney until you're 26 years old.
That's correct. Yes, sir. Yep.
Oh my
Okay.
God.
Yeah. So I mean, I was living. Now, mind you, I was a preemie. I was born like 1 pound 13 ounces in 1980. So, and I lived in the state I lived in. I was born in Connecticut. Like, I mean, when you're born, the first thing they look at is your lung development, your brain development, and your heart. They really don't look at the other organs. They don't look at
Mhm.
your liver. They don't look at your kidneys. They want to make sure that
Right.
you're viable to do everything else. So I was in an incubator for like 3 months once I was born. So there was no need to check for kidney stuff at birth. And then throughout the course of my life, up
Right.
until I was 26, I had good blood pressure. I was able to give blood to people. Like I was first to go to blood banks and give blood. It was the very first thinking. Now looking back at this, 20 plus years ago now, 15 plus years ago, I went to try to give blood, and you know how like they kind of take a drop of your blood and they put it in this machine to see if I guess if it drops to the bottom or if it stays to the top. I forget which it was. Whatever it was, it did it the opposite of what it's supposed to do, and so it concerned me. And I was like, "We're like, yeah, you can't give blood." And this was the first time in maybe 10 times that I couldn't do it, and I was really upset. I was like, "Why can't I give the blood?" And they were like, "Well, something to do with the way your blood is. It wouldn't be good for people." Basically, that's what they're telling me because I had such I was having blood issues or kidney issues that at that point didn't know about, but that was probably the very 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 first sign, the symptom. And so that happened when I was 25. But yeah, so it took me almost a year to really get full blown symptoms of the kidney disease before I was diagnosed with it.
Right. I'm having an issue on my end. I will be right back with you. So to continue on, please,
Sure.
Lisa and Alex, I'll be right back. I'm
Okay.
freezing on my end.
Sure.
Well, it seemed to have come right back. All right.
Okay.
My video was freezing on my end. All right.
Okay. No problem.
All right. So then, so were they able to get your blood pressure to stabilize? Did they
it took a while.
Prescribe you some beta blockers and
yeah. It took a while, but yeah, they were able to get it down eventually. I don't remember what they did, but they eventually got it down.
All right, and then unfortunately, what happened is your one and only kidney eventually reached end-stage kidney disease.
Yes, sir. Yep.
You had several surgeries early on.
So yeah, so I, during my dialysis time, that very first round, I have a lot of like vein issues. Again, being a preemie, it is one of those things where I had this vein and like just it's even currently now today, getting blood from me is really impossible. Like I have a blood clotting disorder, and so the clotting factors there's issues with my clotting, and so I'm thinking that when they went to go put in my fistulas, I had like easily 15 or 20 surgeries in that first go round of dialysis, of hemodialysis, because they couldn't get my veins to work right, and I was always clotting them off, or I never got a fistula to work in all my times of being on hemodialysis.
And let's sort of elucidate. Let's expand on this a little. So before a doctor goes to install, I don't know if install really is the right word for it. Before
sure.
A fistula is placed inside your arm, they do a vein mapping.
Correct.
And they do that vein mapping to find out where the best place would be in either left or your right arm. And that's when they found this out then.
Yes, excuse me. Yes. I mean, I'm pretty sure, and as I think about this, let me go back in that history. The blood clotting disorder was, they found out I had issues with my fistulas, so they sent me to a vascular doctor, and I went to see hematologist. Forgive me. I saw a hematologist. The hematologist ran like a boatload of labs and said, okay, you have this thing called antiphospholipid antibody syndrome, which is I guess a common blood disorder that most people have, that it clots too fast. So I need to always be put on a blood thinner. So I was put on that, and then so the dialysis, with the fistula, it just never. I mean, by the time they were getting ready to put a third fistula in my leg when I got my first transplant, so I got fortunate enough to not have to get that third fistula. And then coming back to it now, I just went with PD. Yeah.
That I could understand why. I could very well understand why you would choose PD then over having a fistula placed in your leg.
Yeah, no way. Nope.
Wow. You gotta have it put in the right place for you, Mine was
Exactly.
fine. I had the same one the whole 12 and a half years. The change that I was on dialysis. So I'm glad that PD is working for you too. You have to. That's another thing. You always have to find out what's going to work for you. And
Oh,
you
of
did.
course,
I
of
ain't
course.
mad at
I have a lot of fibrin. What they say, they've told me when I was on hemo for that short 6-week period when I was on hemodialysis, they went ahead and like with my, they never went to any of my fistula. They just put me a tunnel catheter in my chest, right? So even in the
Okay.
short time I did hemodialysis, I was clotting off then because of the blood clotting disorder. So and some of it was the vein issue, some of it was the fibrin that builds up of the scar tissue that's on the tip of the catheter that's like lines to the artery in the venous chamber of the catheter. So I mean, I was having issues even in that short period of time waiting to go on PD. So there's no way I could do hemo again because I'd have to deal with the fibrin and it would alarm a lot.
Not for the long term anyway.
Yeah, right, exactly. Yeah.
That'll take the machine right off. Yeah.
I mean,
Yeah.
I mean, there are people who have to have fistulograms done to get the blood declotted.
I had a bunch of those. Yeah, I had a few. I can't even remember how many I had of those. I had a bunch. Yeah, a bunch.
I could just imagine.
We got a real warrior in the house. My goodness.
Who's
Come
this?
on here. Woo.
Yeah. Oh, yeah. I'm reading this. Oh, wow.
Wow.
Okay.
You've been through the gamut, but look at you. You look like a miracle walking. I mean, come on. Wow. Mm-hmm. In spite of all of that, you're doing dialysis, you're waiting for a kidney. We're going to try everything to get that thing tonight. How about that?
Let's do it.
That's what I'm talking about, Lisa.
Thank you. Yeah.
I love the energy that Lisa brings. Awesome.
Mm-hmm. Definitely.
All right. So you were okay. So you're originally from Connecticut.
Yep.
You've also lived in Arizona, the Grand Canyon area. Is that right?
I did. After my college years, after I graduated from college, I took a year and said, okay, I'm going to go to a place where nobody knows me and just kind of start over, sort of, or in a way, and just kind of like, all right, I'm going to go. And a friend of mine was like, go to a national park. I'm like, what are you talking about? A national park? He's like, you could get paid to go to the national parks and like hike and work there. So I worked as a waiter for a year, and just kind of waited tables and met some really awesome people in that year, and met my now ex-wife, but my wife at the time, or fiance at the time, who's from Kentucky. I followed her back here, and after the year I was in Arizona, and I've been in Kentucky now. It'll be 16 years in October for me, so I consider it home.
Wow.
Yeah. Well, after 16 years, I mean, I'm sure it's home.
Yeah.
Like,
so wow.
Mm-hmm. It's a great place.
You're registered. You are registered with the University of Kentucky.
Yes.
How far away is that from you?
About 70
miles.
Did
you choose?
So
why did you choose it?
Mm-hmm. There are two. So the way it works, the transplant centers in Kentucky, there are two in the state. There's one in Louisville, which is where I live, which is where I got my first transplant, which is Jewish Hospital. I could have gone there, or the University of Kentucky, which is in Lexington, which is about an hour east of us. No, yeah, I can't remember. Yeah, 71. I guess north. I don't know what direction, but it's about an hour away from me. And I at the time was working for the University of Kentucky in the transplant program, so I had an in with the surgeons, and I knew some people in the program. So I was kind of knowing where my kidney was kind of going. I was trying to be preemptive, trying to do preemptive kidney transplant, but the kidney eventually failed. And then, it happened. COVID happened first. I was transplanted. They kind of furloughed me in the position. And then when I was going to come back, my kidney was failing. And I said, yeah, I'm not sure if I can work and do the job that is expected of me. So I took the unemployment, and then now I have a new job. So, but yeah, so I chose UK more because, I like the doctors, and I know them personally a little bit because I worked with them. And nothing against Jewish Hospital. Right. They're good. They're a good facility. They've done transplants. They've had their issues and their certain things going on, but for the most part, what hospital hasn't had their issues, right? So
exactly. No hospital
no hospital is perfect. So what's that, Lisa?
No, I'm laughing because yeah, they do. You know, no matter which one you pick, they're great in this area.
Yeah.
Something's falling somewhere. You know,
Right.
whether you know it or not. You know.
Exactly. So yeah, so I picked UK. And I'm also currently working up with, so in my region, and I'm sure you've talked about this previous warriors, but like you can be listed in multiple regions around the country, around wherever you live. So
Right.
I can choose from in Kentucky, I can choose between Jewish and UK for one of the regions. Then I can pick either Ohio. In Ohio, there's Cincinnati, or there's the University of the University, the Ohio University, State University, Ohio State University. Those are two I can pick from. And then
Mhm.
up further north is Indianapolis with IU, and then further south is Vanderbilt and Tennessee. And those are all different regions that I could pick from or choose from.
Vanderbilt,
As
right,
Vanderbilt,
Tennessee.
yeah, Vanderbilt's right, about 3.5 hours from
Mhm.
me, so I could get to Vandy. I haven't tested with them yet.
That's
But
a really good one.
Cincinnati,
As a matter of fact, a good someone I was advocating for was just transplanted there, Devin King,
okay.
uh, just
Congrats.
last week.
Cool. Yeah, no, Cincinnati. So I'm working with Cincinnati right now. So the issue I'm
Uh-huh.
having, and I'm sure being my second transplant, my panel reactive antibodies are at 100%. So finding a match is challenging because of my
Right.
antibodies being so high, and so there's an opportunity to get desensitized with UC. UK doesn't do that to your antibodies because
Okay.
they just
Right.
don't.
So
So go ahead.
yeah, that's very smart of you to be proactive in that part because
Hmm.
yes, since your PRA is so high and that comes,
Mhm.
yes, as you mentioned, with prior surgeries, your
Blood
transplant,
transfusions, transplant. Yeah.
blood
Hmm.
transfusions, and yeah, desensitization programs aren't done everywhere, so it's
No.
wise to proactively go out and search those transplant hospitals that do it.
Exactly.
That currently has been the problem that Chris Ann Hernandez has had
Uh,
as well. So she sought out
Yeah.
the University of Illinois, who does it,
yeah.
the
Hmm.
Mayo Clinic
Hmm.
in Rochester, Minnesota.
Hmm.
Wow.
That's good to
Well,
know. Yeah. Yeah.
you've done your homework. You know what I mean? I always say you have to be educated about your illness or, what you're doing with it and how you're dealing with it. And, you put yourself, it's good to put yourself on more than one list. It's good to know how your body is. You know that you got
Hmm.
the one, you're on your second transplant. You know what some of the things that you're going to encounter or go through. So I
Hmm.
like that you're still being a soldier in spite of that. You know what I mean? You're still keeping
Thank
it
you.
moving.
Yeah.
You're still
Yeah.
working. You
Yep.
know what I
Have
mean?
to.
You still bring it.
Yeah.
You know what I'm saying?
Hmm. Hmm.
Please. So you took psychology in college, right?
I'm sorry.
You took psychology in college.
I did. I was a minor. I minored in psychology. Yes. Yep.
Okay, all right. Has that helped you in anything that you've learned help you
I mean,
with your situation at all?
a little bit.
Would
I
you
mean,
say?
in some of the people I've come across, and some of the socialization, more like sociology than psychology, more just kind of the interaction with people and different different warriors are different ways, some personalities are different ways, some of the doctors are different. So it just really depends. A little bit. I mean, more just kind of I think the interaction and how certain people I think take transplant as a scary thing. Some people are like gung ho about it. So it's interesting when you talk to different warriors and different folks who've had a
Right.
transplant, who haven't had it, and or officialist stuff, or like I've been through the ringer, and I'm 42 years old, so like I can speak to it pretty well, and tell and I'm one patient of the thousands that are out there, so I'm not saying that everybody's case is different, so like it's not a one size fits all model.
That is true.
Um,
Right.
and so I think it's one of those things just to consider. Here's my son Xander coming through. Hold on, you can
All
say hello.
right.
Hey, buddy, this is Xander.
Xander in the
Say
house.
hi.
How
Yeah.
are
That's
you?
what I'm talking about. How you
Say
doing,
hi, buddy.
buddy?
Mhm.
You doing good? Good. Yeah.
All in the family.
That's what I'm talking about. So, how old are you, Xander?
Oh, can I hear him? Xander?
Uh, you got muted, Alex.
Go ahead.
Hi.
Yeah, there we are. There we
Go
are.
ahead. He wanted to know. What was your? Go ahead, Jeff. Ask the question again.
How old are you, Xander?
6.
6.
Six.
All right. That's what I'm talking about. Very nice to see you and meet you, Xander.
Okay, buddy. All right. I'll be back later. Okay. All right.
Appreciate that. Thank you. Wow.
Yeah, that's my son Xander. I'm just so right now I'm just he and I this weekend. His my fiance is in Florida, actually in Tampa on a girls' weekend. So he and I are just hanging out while I do, while I'm doing this. But it'll be a nice weekend together. And my daughter and I I'm gonna see my daughter tomorrow. So it'll be a nice weekend.
Great.
Yep.
Yeah.
All right. And your daughter Abigail is she 9?
11.
11.
So that's if you think about like when I wrote that, probably it was 9 when I wrote that, when I wrote my little page. But yeah, she's 11 now.
Okay, so that's what I was thinking. Yeah, I was running through a lot of information prior to the broadcast, hours earlier, and that's what I read on she was 9. But yeah, of course, you made that 2 years ago.
Yeah, I know. Yep.
Wow. And they grow up so fast, though, man. I
They
mean,
really do. Yeah.
I mean, people say that loosely, but it's honest to goodness truth.
You blink, man. You're like,
my
holy
oldest,
mackerel.
Yeah, I mean, my oldest daughter is now, she's 21.
Wow, bud. Wow. Yeah. Okay.
And every time I still can't come to grips with her, her age.
No, it's unbelievable. No, I tell you, the fact that my son is 6 and feels like he's already like 10, and my Abigail, I feel like she's 11 going on 15. Like, she's like an old soul. Like, I feel like she's like in her 30s already. Like, it's just so hilarious, some of the things they say, at their age.
Yeah.
It's great. I mean, it's what parenting is. It humbles you too. I mean, not only like I was telling you earlier about how having to support all the warriors here talking to me and supporting me as I look for a new kidney, that's humbling. But even being a parent, it's even more humbling. I mean, the things that kiddos say, they come out of there, it's so you're like, you said this, and it's so true sometimes,
Right.
They're straightforward most of the time, and you seem to have a good relationship.
True, no filter.
Yeah, exactly, yeah.
Do they know? Do they understand anything, or do you share anything about your what you're dealing with?
I try to, and I think they both are not really ready to have that conversation. I think they're still a little nervous, and their daddy's on a machine, so I try to tell them what's going on, just so for their knowledge, right? So, hey, daddy's on this machine tonight, and this is what I'm going to be doing. And a lot of times, like Abigail asked me, because she's older, of course, she's like, does it hurt you? I said, no, PD doesn't hurt. It can be uncomfortable and it can feel bloaty kind of feeling sometimes when you have that fluid in you, but it doesn't hurt.
Yeah.
And so, and with Xander, he's just like, he's very careful, and, he wants to wear a mask when he's in the room with me. If I'm setting up the machine, he'll come in with his mask and help, set up or not help set up. He'll watch me kind of set up and just kind of be available. So yeah, I mean, to answer your question, Lisa, I mean, I will tell them as much as they want to hear, and then I'll kind of let them kind of ride that kind of guide wherever they are, and when they're ready to ask more, I'll tell them more.
Well, that's a smart move, I mean, because everybody is not ready, and everybody can't take it. My great niece used to tell me and my sister, because I had 6 siblings on dialysis. She said, "What? You went to that doctor again?" Every time she saw the fistula stick out, she said, "Oh my God, did I tell you not to go really little? Did I tell you to go back to that doctor?"
Yeah, totally.
Well, first, Lisa, remind me. So you were on dialysis roughly 12 years. I mean, that's an extraordinarily long time. Were you on hemodialysis the whole time, or did you also do peritoneal as Alex is doing?
No, I did hemodialysis. I didn't want to do anything at home, whether it was hemo or peritoneal. And I saw the good and the bad, my sister and brother doing peritoneal, that I said, listen, I didn't want to put my husband through it, and then I didn't want the extra work. And then I'm a social butterfly, so I needed to be in the center, even though I wouldn't want to be there, But I was on chemo, and that was what I was dealing with, basically. But we would
Hey, Lisa, what happened to how did your kidney fail? If you don't mind me asking, where you've been on dial?
It's all out there. My father had polycystic kidney disease.
Got it.
My
Okay.
sister had, but one brother, he was on because of diabetes. He was the only one on because of diabetes, and he also died on the machine as well.
Okay.
They were watching him, he bled out and died. But
wow.
yeah. So this is dear to my heart that you would get a kidney. I'm the only one in my family who got a kidney. Nobody else is looking or trying, and they were scared.
Yeah.
So I had to try to listen. Let God do it. You can't scared of everything. If I can live on this, I could live on that. That's all I can say.
Right. Sure. Yeah.
Yeah.
Now you incurred this due to the problems we discussed earlier, Alex, kidney disease, and problems that your one kidney sustained, and that ended up failing. Being born with one kidney, as far as I know, that's not hereditary. It's just something that happens with people, and although rare. But has there been anyone else in your family that's experienced kidney disease?
No, nobody there's not been anybody who's come like out of the woodwork to tell me they've had it that I know of. And I have a pretty large family. I'm both my mom is one of 9, and my dad is one of 5. 4. Wait, hold on. 5. He's the 5th. And so
and your sister and brother
both have no kidney issues at all. Yeah. I have cancer in my family. I mean, that's pretty common. My sister had breast cancer. My dad's been having prostate issues, and my mom has colon cancer. So there's some stuff going on there. But yeah, so there's just things that are hereditary, but kidney wise, no. Yeah.
Right. Yeah. And much like you said, diabetes runs heavily in my family, which is one of the top 2 causes of kidney disease.
Right.
People forget, and my father died of prostate cancer, my mother of breast and liver cancer, but people tend to forget that kidney disease is the 9th leading cause of death in the United States.
Right.
Right.
I was just in a conversation. Yeah.
I mean, 13 people die on the average every day of kidney disease.
Yeah. Yep.
It just don't get enough love. It just doesn't get enough recognition or love or nothing put out there. You know what I mean?
What they say, what I hear is like it's a life sustaining, so dialysis, right? If we didn't have dialysis, for liver or lung, there's ECMO for liver or heart, there's some disease, there's some machines out there that kind of help leave a little bit, but dialysis is
one for the
heart. So I feel like people are like, well, you have dialysis, boom, it's don't you realize dialysis, yes, is a modality, but it's also not the end all be all. I mean, it gives you life. It may not give you the best quality of life, and so I think that's something to let people know, to make beware, like you kind of said, Lisa. There's no buzz about kidney disease like there is cancer. I've always been told that there's not you see all the back in the day when football players were wearing pink for breast cancer awareness, and nothing against breast cancer awareness. I think they have a great marketing campaign. That's awesome. But why can't we do that same thing with kidney disease? Why can't we put it and make it the same way we do
exactly
liver cancers?
I've been trying to,
and you know what?
It drives you crazy.
I can't wait till the day where it finally gets its recognition. And speaking of breast and prostate cancer again, so kidney disease actually, more people die of kidney disease than breast or prostate cancer each year.
It's crazy. Yeah.
And people don't know that. They think it's the other way around.
Yeah.
The other way around. But I was
Now,
trying
while-
to get a commercial or a program where we really put in it and not that little thing where you see the person, they on the machine and they pass it down. That's all. They don't say nothing else, tell nothing else. I'm like, come on, tell the real dirt about it.
more,
Come on, what
yeah.
about the throwing up, the vomiting, the leg cramps,
Cramping, all of when your blood pressure drops and you fall out. I mean, all of it. I mean, yeah, exactly. And
I thought I was dead so many times with that low blood pressure. I could hear my husband though. I could hear him talking to me, and he would bring me back. But I'm telling you, that's a horrible feeling. The room starts getting dark. Oh, forget it. They don't know the half of it. That's why I feel myself on the machine, and I talk about that. People got grossed out. They said, "Oh my God," But this is what I want you to know.
Exactly. And I think even in the education for the nurses and the doctors, like why, like I was in the hospital about a month ago with peritonitis, and that's never fun with being a PD patient. But I was in the hospital. Yeah, it's not fun. So I was in the hospital, and my nurse had no idea what to do with dialysis. Like they're a nurse, like they have you would think they'd have a rotation on kidney, but they don't really do it. Like that's a case in point. Like if you're a nursing school student, I would feel that's a no-brainer of like a rotation. I mean, you go through all the, you do through med surg, you do cardiology, you do all these other ones, but why isn't there any opportunity to give these nurses more education on kidney disease? Like, because I think that the nurses do so much more of the work, when you're in a patient bed, needing dialysis, that they should be able to do it, and they should be able to walk you. They should have the training to be able to do that. Any nurse should be able to walk in the door and know how to do it.
Totally agree. Very good
That
point,
should be
Alex.
a show by itself.
Right.
I'm sorry, that should be a show by itself.
Yeah.
Or a picture by itself. A button.
Amen to that.
Yeah.
Especially since kidney disease in the United States affects roughly 37 million people.
Mm-hmm. It's a quiet disease, and it's early. I mean, and like I crashed into it. Like I work for a company now that's working on preventative care and trying to get people who may have early stages of maybe their creatinine is a little high, maybe their GFR is going, everything through their GFR, whatever they have, they have signs of high blood pressure or their diabetes is crazy. If we can get them on the front end and talking to a nurse or a doctor or specifically who's a kidney specialties, like a nurse practitioner, and having them walk them through it, the less likelihood they're going to be crashing into dialysis 6 months, a year later. So if we can get them on the front end, again, that's a no-brainer. Right. It saves money. There's so many different opportunities. So the company I work for, I work and do that. But yeah,
I applaud your right. I applaud your company and your efforts to do that. More healthcare systems and hospitals and nephrologists should be just as proactive in that, so that people get on the preemptive transplant list, avoid dialysis, and can foresee it coming early on.
Exactly. I feel like primary care doctors also could be, or internists should, if they start to see when you get lab values, every year you go in for a lab, you get a colonoscopy, you should get your kidney numbers checked every year and see where your creatinine and your GFR are. If they're at a particular number, okay, maybe do the referral, or maybe look at diet and exercise, or look at other opportunities or ways to get those numbers back into stable, into where they need to be. It sounds so easy, but it's a whole paradigm shift, I think, in our healthcare system that needs to be looked at.
It's like pulling teeth. Alex is like pulling teeth. The company I work for, we went to work there because that section been dying prematurely for kidney disease, heart trouble, obesity. So we put the office over there. And you would think it will be flooded with people, but it's not. But we connecting to other organizations and trying to do preventive care and talk to them. And we working with dialysis clinics, incorporated under their umbrella. But it's just really hard. We don't give up. I try all kind of tricks. I don't care what I got to do. If I got to sing, do a skit or rap, whatever, you're going to hear about this kidney stuff.
Good, Lisa. No, most definitely.
That's right. We're going to see Lisa jump on top of the rooftops, right?
There you go. There you go. Yep.
Screaming kidney disease education.
Exactly. Get it, learn it. Come on.
Oh my God. Oh my God. Well, you was an advocate, right?
I'm sorry?
weren't you an advocate or something?
I mean, I still am. Yeah, I do it. I mean, I've been involved with the National Kidney Foundation and been involved with the American Association of Kidney Patients. I've done talks when I was transplanted all over the country, talking to different pharmaceutical companies about my story, and getting the patient voice heard as best I could. Still kind of do it on the side the best I can. And like I said, I'm still working in the kidney space, on my full-time job. I mean, after my time at UK, I get, furloughed because of COVID. The company I work for is a health tech startup in San Francisco, that I work remotely for. And they're great. They're a forward-thinking company, great culture, and it's specifically in the kidney space because they know it's a need that needs to be met.
Oh yeah, I'm loving that now. I'm loving that. Do your thing, brother. Do your thing. You ain't sitting in the corner. You doing your thing. Come on here.
Thank you. No, I'm definitely going to continue to do that. Continue to.
Yeah, that's awesome. It's wonderful to be able to work in a capacity that you thoroughly enjoy. I mean, not everyone can say that.
I've been fortunate. Yeah, I've been very, very fortunate. I mean, I'm not, and I don't have, I mean, I hold a college degree, but that's the extent of it. I don't have anything. I'm not like, I don't have any licensures. I'm not a nurse. I'm not a doctor or a social worker. I just happen to be an advocate who's very passionate. And I would say I like to bring people together, who have who have both different ideas, but need to kind of connect. I like to link them together, if I can.
Right.
So if I can, link a service that's, in Florida with somebody who's in California, I have connection through both people. I can connect them and say, hey, do an introduction, be like, here, this is so-and-so, this is so-and-so, do your thing. and just know that here's an opportunity for them. They wouldn't have known of each other otherwise if it wasn't for me. So I try to kind of do that as best I can.
Excellent.
Awesome.
Fantastic.
So I have your information scrolling across the ticker.
Yep.
Alex, your blood type is B, so you can accept B or O for a direct donation.
Of course. And then
however, your transplant hospital, the University of Kentucky, also does the paired exchange program.
Correct.
Right?
Yep. Yes, they do. Mm-hmm.
So for those who aren't aware of what the paired exchange program is, perhaps you could explain that real quick.
Sure. So the paired exchange program is basically, if, say, for example, Jeff, you wanted to donate to me and you were, say, AB, we find this out, and we just didn't match. If you chose to then altruistically give a kidney to somebody else from either the National Kidney Registry or a particular paired exchange program, you could donate to somebody in another state. I then can swap with somebody either through a voucher program where I can get a kidney down the road when it comes down the pike from finding it somewhere. This particular agency, the National Kidney Registry, is able to kind of find kidneys that would be beneficial in my case for me, knowing that I'm B positive and then I'm also highly sensitized with my 100%, that they find the harder kidneys for people like myself, is what I've understood. So the paired exchange, is basically swapping. You and I, if you wanted to be my direct donor but didn't match, you could donate to somebody else, and then that person can donate to me, and we can create a chain sometimes in that way. Yep.
All right, now it's awesome how these systems are put together to benefit kidney warriors, and this one certainly is.
Mm-hmm.
I mean, if you don't have a compatible blood type, your transplant hospital will put that person in the system, and we'll find someone who is compatible, and it could end up being a chain effect up to. I mean, it will originally affect 4 people, but it could end up being an 8-person chain to even more.
Right. Exactly. Oh yeah, I would love. That'd be great to do that. I've seen some amazing chains out there too.
Right.
Give you a bigger chance.
And so, is the University of Kentucky affiliated with the National Kidney Registry then?
They are. Yes. Mm-hmm.
All right, that's a good thing.
Yes.
Because if you decide if the person who comes to donate on your behalf is not compatible and they decide to go the way of the voucher program, that is something spectacular for someone such as you with a high panel reactive rate. Shane Blanchard recently.
I picked his brain. Yeah, I know. I talked with him. Yeah.
Right. I mean, his cousin Jeremy Hauser donated on his behalf through the National Kidney Registry.
Right.
Okay.
And like within 2 weeks.
And
right? Crazy. Yeah.
Not even a full week later. Okay. Shane Blanchard got the call up, for a cadaver kidney. And
it's amazing. That's so cool. Yeah.
Right. So the National Kidney Registry voucher program, it works, folks.
Yeah. That's so I'm hoping that's hopefully the route I can take. I have had a few folks say they want to test for me. I said, listen, you don't have to have me by blood type. If you want to still voluntarily donate and give me your voucher, just go ahead and do it.
Exactly.
That's what I've told people that.
And let's chew on that bone a little bit here, Alex.
Yeah,
so
sure.
you're going to be doing PD later this evening.
Yep.
And how many hours do you do PD? And then tell us how a kidney donor would change that quality of life for you, and how it would change your life.
Of course. So for peritoneal dialysis, everybody is of course different, right? My prescription is for 9 hours. Some people run 10 hours, but I run on a cycler machine. It's 3 bags, and it's usually a dialysate fluid of a 2.5. You have 3 choices of a 2.5 bag, which is green, a 1.25 bag, which is yellow, or a 4.25 bag, which is red. Each one is a little heavier and stronger in how they pull the toxins from your body when it's in your body dwelling. So I do right now, the way my weight is and my blood pressure and stuff, I do 3 green bags. And it works for me. And I usually pull my ultrafiltration is anywhere from as low as 500 to as high as like 1200, which I think is okay. I've had some negatives somewhere recently too, which is kind of strange, but my nurses don't seem too concerned about it. I'm not having any swelling that I'm feeling or seeing, or no fluid overload, which is good. So to your point though, to your last point, yeah. So if a donor wants to step up and test for me, it changed my life in so many ways. Obviously, I wouldn't be attached to a machine for 9 hours a night, where I have to deal with, with being stuck on a machine and just having to kind of like not be there for my fiance, not be there for my son, or walk my dogs at night, so it's something that I feel, I feel a burden sometimes, I feel like it's struck. It's really tough sometimes to have to sit there.
In essence, you're tethered to this machine. It's your lifeline. Without it, you wouldn't be alive.
Right. Exactly. No. Yeah. Right. I mean, it definitely is the lifeline. I mean, it's been fortunate like that. I don't feel like, it is a lifeline. And you're right. If I didn't have it working, I could die in, days, month at the most, So from what I'm hearing. So, yeah, I mean, it is something that you just do every day. And, it's something that, it is lighter on the body. It's not as intense as hemo, because hemo, you skip a day and it's just different with the blood. It's just lighter. I'm able to not be as restrictive on fluids and stuff like that kind of stuff. So that's helpful. So there are good pluses to PD. Obviously, we talked earlier in the beginning of the show about how being able to have my freedom during the day and be able to work full time. I work from home, so I'm able to kind of get in front of a computer and do my work for 8 hours, 9 hours, and still make dinner with my family, can go out, and then know that about 8:30, 9 o'clock most nights, I'll set my machine up and get ready to start my, it takes me about 15 to 20 minutes to set up my machine. And then I'm on connected for like about 9.5 hours, and then, disconnect and, go about my day and usually clean up the machine, later in late part of my morning on a break from work. But yeah.
Right.
And you said you had 2 dogs. Some people usually get infection from animals. I know my sister got infection all the time from a cat and a dog. Till it got so bad she couldn't even have a belly anymore.
I know, and you can kind of elaborate on this, Alex. When
Yeah.
you're doing PD, you have to have a super sterilized environment. So they're
Yes.
not, they don't exactly tell you not to have pets at home,
That's
but
right.
simply that
That's right.
when you go to sterilize everything, that they
Close the
can't be
door, have
around
them
when
away.
you're doing it.
Exactly. That's
Right.
correct. That's exactly what it is. Yeah. Yep.
They do tell you that. You know, fortunately, you know, that happened to her, but you know, that wouldn't be the only one. But you know, I'm glad he's not getting any of that from them. You know what I mean?
I mean,
Or
I did have, like I said, I did have a bout of peritonitis. I don't know how I got it. I mean, I did have a couple of moments of weakness where I wasn't as sterile as I should have been. I may have had my fan on, or I may have had my door open, but my dogs weren't with me. I never have had my dogs in the same room when I connect, and I don't know. I mean, you know, but I've had it, and you know, it's human error. You know, we're not perfect, no. So I had my bout of it. You know, I also had COVID, so there was rumors that COVID was also causing peritonitis too. So who knows?
Jeez.
Yeah. Mm-hmm.
And I know very well. You went through like a 1 month period where you were just
horrible.
not well at all. And
yeah, it was horrible, man. Yeah, it was. Yeah. Mm-hmm. It was bad.
Well, you're well now. I'm glad to hear and say.
yes, I'm doing well right now, and that's what. Yes, I am. Mm-hmm.
Right.
Yeah.
Now, I'm not so sure about the percentage, you know, with peritonitis, right? But the fact of the matter is dialysis only does 10 to 15% of what a kidney really does, folks.
Correct. Right. Yeah. Yeah. Mm-hmm.
And it's what's keeping Alex alive right now. But fact of the matter is, if someone comes forward graciously enough, compassionately enough to be his living kidney donor, it would not only give him the long-term quality of life, but it would change his life drastically to the point where he wouldn't have to be tethered to this machine for 8+ hours every night. It would give him more freedom, flexibility to be with his family members. And we discussed the ages of his kids so far. They're still very young. He has a lot of life ahead of Alex is very young in relative terms as well. I mean, my goodness. Please, folks, so you're watching this video now live or on the replay later, dig down deep in your hearts and ask yourself the question: are you healthy, able, and willing and or in position to be his living kidney donor? And if the answer is yes, right? The information scrolling at the bottom of the screen, make the phone call and be his kidney hero. If you're not able, healthy, or willing or in position to do so, you can still help Alex by pressing the share button and giving him words of encouragement and comments, right? That share button, believe it or not, could potentially reach his living kidney donor. You just never know.
Thank you. And for those folks who have questions, you know, feel free to comment, email me directly through Facebook. Find me on Facebook. My profile is easy to find. Alex Barrios. You can't miss Junior. You can't miss me. And if you have questions about like what the logistics are and how much time you need to take off, because there are logistical things like, you know, being able to, you know, how much time you have to take off as a living donor, and you know, can you do that? Are you retired? Are you working? Whatever the case may be, I can help you answer those questions. My insurance would pick up most everything that you're going to go through outside of travel, and even then, if you're traveling from far away, there is the National Living Donor Assistance. It's called NLDAC, NLDAC program. Yeah. And I've worked with them briefly on their advisory committee, and know that that program is there for helping for reimbursement expenses and flight and things like that for possible living donors. So
right,
if somebody want to do
travel, lodging.
Mm-hmm. Yeah.
Right. Very, very good points, because those are some natural worries or questions that people have. Okay, I'm coming from out of state.
Right.
Who pays for the travel, lodging, you know, meals and incidentals?
Yep.
Mm-hmm. I'm glad you said that and stated that, put it out there, because that's one of the main questions that they do ask. And if they do this, they're doing it at Kidney Month, a month that we, bring awareness
Yeah.
and bring hope and want hope, brought. So this would be a good chance and a good time,
Yes, ma'am.
Absolutely. And thanks for reminding us about that, Lisa. It is National Kidney Month. And then there's even the National Kidney Day within the month of March, if I'm not mistaken.
Okay.
Can't remember what day it is.
I'm not sure. I didn't know that. Yeah.
A good time and a good day. And the things you said can be brought to legislation, when we, go to Capitol Hill or go,
Right. Yeah.
So this is a good show to bring these things out and to say these things, bringing awareness, getting you a kidney and everything.
Yep.
What was the first thing you did when you got your first transplant? And what would be the first thing you do when you get this?
Oh, great question.
Excellent question.
The first time, I think I'm a big foodie, right? So like I had something with lots of cheese because I knew phosphorus was always something I had to watch out with my transplant. So I probably had like a good piece of pizza or something like that, I think.
A piece of lasagna, right?
Lasagna, something exactly. Yeah. I probably, the second time around, I probably would start to, I don't know. That's a great question. Once I was healed up and stuff, I mean, God, I don't know. I mean, I'm older now, so like, and knowing I've been through it the first time around, I try to, I just try to really just enjoy time with my family more and really just like hone in on the energy level. Because I mean, my energy level now as a dialysis patient is down the toilet, man. It's just there's just definitely a struggle of keeping up with my kiddos and like just feeling heavy all the time and tired.
And that can be frustrating. I mean,
yeah,
you have a 6-year-old boy.
Yeah.
And you'd like to be very energetic, and go out and play sports with him and do all these different things.
Right. And I can't, not without falling asleep on him or feeling like I'm just like, I'm 42, but I feel like I'm 82. And, I don't want to feel that way anymore. I want to be able to, feel like I can, have a little bit more energy and pep in my step. And getting a kidney would definitely help me there. I mean, I think I hope that somebody out there would be willing to really consider this and, know that I'll pay it forward. I mean, I'm very involved in the kidney space. So, that if whomever is out there is willing to donate and test for me, know that you're going to be on blast with me and I'm going to talk you up very highly to what I'm doing and knowing the importance of spreading the word. I spread the awareness with my first donor all the time. I mean, she and I do talks and, I talk about our story all the time. So I gladly share my new story with a new person, whoever's willing to do it. So please consider
all
it.
Right. So exactly. Well, let's recap a little bit. Some of the ways that they can find you on social media. Alex, you were talking about, so you have an Adobe Spark
Yeah,
website
I have
that was
a
created for
website,
you.
Adobe Spark website that was created for me through the IgA Nephropathy Association of America. One of their marketing people made that for me and just created it. And so that's a lot of my information there. Through that website is just, like I said, the link to what's also scrolling, but also, phone number and a link to the actual survey to go if you're interested in doing the online questionnaire. It's there online. So if you have access to the internet, you can fill it out without having to wait for it. People can call, you could also call in and they can send it to you. You can do it, paper and pen if you'd like to. Ways to get a hold of me. Like I said, I'm on most social media. I'm on Facebook and Twitter. Have an Instagram, but I'm not very present on it. I may start getting back onto it. Not on a TikTok or any of the other ones out there. So you can just look me up in both those. Twitter and Facebook are the top two I use the most currently, and then have high presence and putting a lot of comments and being involved with a lot of different kidney advocacy groups that are in and around Facebook and living donors and things of that nature. So feel free to reach out to me through that. You can email me at my last name, Berrios, BERRIOS, the letter A, 1234@gmail.com. If you want to just drop me a line on email, and we can go from there. We can start that process from there.
Right. And we also have a kidney donor search page on Facebook for you. called A Kidney for Alex Barrios Jr.
Yes. Yep.
Share the
All right,
love.
so
Share-
exactly. Let's find Alex a kidney hero, folks. Help us help Alex. I want to thank you, Alex, for allowing us to do this broadcast this evening, making the time for it, and I want to thank you, Lisa, for being fabulous and being my co-host this evening. It's always a joy for me to be in touch with you and to have you as a co-host.
My brother to another mother.
You guys have been awesome. I really enjoyed this, and look forward to talking with you guys again in the future, connecting with you guys in any way possible, sharing
Right.
my story in any possible way. Like I said, I'm definitely here to help. So I like to pass the buck, not pass the buck, pay it forward if I can. So I'm here to help where I can.
Thanks.
Okay, we're gonna stay.
Sure, folks. And the best way right now to share this message is to reach down and click that share button. Whether you share it on Twitter, Facebook, Instagram, in some way, shape, or form on TikTok. Share it on all the social media platforms. Let's make this go viral, folks. It's for one of the best causes you can imagine.
Definitely.
Do you think?
Share. Let's do it.
All right. Thanks very much, Alex. Lisa,
Thank you.
it's always a pleasure. All right. I'm going to
appreciate it.
continue
Yeah.
marching forward in your corner, Alex. I'm always here for you. All right.
Yes. Thank you, man. I appreciate everything you've done. Thanks so much.
You're
Lisa,
welcome.
thank you again.
You're welcome. Thank you.
All right.
Appreciate it.
All right.
Appreciate
God
you.
bless you all.
God bless.
Bye-bye.
Bye. Uh-oh.
Just bear with me here.
Sure.
Thanks.